Good morning, I'm Dr. Jyoti Patel. So today's topic is the ketogenic diet. As a healthcare provider, I first want to let you know that my intention is simply to educate. I'm not here to recommend any dietary plan, but simply offer information so you can have an open conversation with your healthcare provider and see what type of nutritional plan works best for you. Okay? So a ketogenic diet, what is that? That's where you get most of your fuel from fat. Most of us get our fuel from carbohydrates, but there's been a lot of studies and a lot of health benefits for patients that choose to use fat as fuel. So fat gets converted to ketones and the body uses ketones for fuel. Now it's the easier path to use carbohydrates, but again, for folks that want to do a keto plan, they eat 70% fat, 25% protein, and less than 5% carbohydrates. Okay, so before you go on any meal plan, it's really important to know what the contraindications are. There are a lot of contraindications with the keto plan. First of all, if you have a disorder of fat metabolism, if you have a mitochondrial disorder, or if you have a metabolic dysfunction of some kind, you probably don't want to go on a keto plan. Some of the other contraindications are if you have gallstones, if you have gout, if you have kidney stones, if you have kidney failure, liver failure, pancreatitis, if you are a fragile diabetic, and if you have any type of myopathy, these kinds of meal plans may not be right for you. So ask your doctor to make sure you get a full thorough checkup before you go on any meal plan. Okay, this is good. All right, so the next thing I wanted to talk about is what is a keto plan, what is a paleo plan, and what is a Mediterranean or low carb plan. Okay. So a keto plan is very specific. It's kind of like pregnancy. You're either in ketosis or you're not. So ketosis means your body is driving all of its energy from fat. You're eating 70% fat, 25% protein, and less than 5% comes from carbohydrates. Okay, so if you eat a 2,000 calorie plan, 100 calories comes from carbohydrates. The rest of it is coming from mostly fat and some protein. The paleo plan is a little different. It's basically like the keto plan where you want to eat more protein and fat, but it's also very inclusive of carbohydrates. They eat no grains, no beans, no lentils, no processed food. They stick with whole foods, and 35% of their calories comes from fat, 35% comes from carbohydrates, and 30% comes from proteins. So a lot of people are surprised that the paleo diet is a little bit more generous in the carbohydrates. Also, they don't eat dairy. Okay, what's the Mediterranean or the low carb diet? It's basically a balanced meal plan where you can eat grains, beans, legumes, you can eat vegetables, you can eat fruit, but you're really reducing the amount of animal products. So depending on where you lie, you might pick something that is heavy on the fat, you might pick something that's moderate, more even keel, and something that's a little bit more geared towards carbohydrates, depending on how you feel. Okay, so before you start any meal plan, it's important to ask yourself, why are you doing this? Are you doing this for weight loss? Are you doing this because you have seizure disorders or Alzheimer's or Parkinson's, or you have heart disease or diabetes? Somebody told you to go on the keto plan. Why are you doing this? Second, can you sustain this kind of meal plan for a long time? Because this is a lifestyle and not a diet. You can't go on ketotic plans for 30 days and then go back to eating carbohydrates because you're just going to yo-yo back up. So it's really about changing your lifestyle. Next, can you clean out your home and your pantry and your refrigerator? Can you convince your family that you want to go on this kind of lifestyle, and will they follow along? Because it's really important to be realistic. If you're not realistic, nothing is sustainable. Okay, so let's talk a little bit about the history of the ketogenic diet. Back in the 1920s, the Mayo Clinic actually found that when children that had refractory seizures went into ketosis, which was on the ketogenic diet, they found that some of these children, around 10%, had a decreased number of seizures. So it has some health benefits. Then again, it was revamped in 2002 by Mass General in Boston, and they actually modified it to a low glycemic index treatment plan, where they gave them as much fat and protein as they needed, but they had them take 50 to 60 grams of carbohydrates, less than a glycemic index of 55. Okay, and then in 2003, they modified it again, called a modified Atkins diet, which actually they were allowing them to consume 20 grams or less of carbohydrates and an unlimited amount of calories, protein, and fat. So that's the history of the ketogenic diet. What is important? So here are some of your take-home simple truths when it comes to the ketogenic diet. First, whether you're going keto, paleo, or Mediterranean, there is no sugar that is really acceptable. So if you're eating a lot of refined sugar, processed food, packaged food, none of these diet plans really include that. So it doesn't give you a free-for-all to eat as much processed cheese or eat as much fried food or oils as possible. It really means that you have to eat clean. So if you are going to go on any meal plan, no sugar, no processed foods, and no packaged foods. So what I mean by that is pretzels, chips, crackers, fast food, fried food, replacement food, things that you got out of a package. These are things that are not really on any meal plan. Second, bad fats. So if you're going to go on the ketogenic diet and you're going to eat fats, make sure you know where your fats come from. If you're eating animal fats, make sure that they don't come from feedlots. So these animals are raised with the worst diet. They're given GMO corn, they're getting sprayed with organophosphates, they're eating toxins, formaldehyde, they're basically given hormones and antibiotics. So because toxins are concentrated in fat, when you eat fat from these feedlot animals, you're getting the worst of the toxins that they were given. So try to eat foods that are grass-fed, wild-caught, organic if you're going to eat meat. If you're going to eat more of a vegetarian or vegan fats, make sure they're not trans fats. Make sure they're not processed oils. Make sure they're not highly refined oils. Make sure that they're good quality oils. And seeds and nuts, of course, make sure that you're getting good quality products as well. Because replacement products of any kind, whether it's vegan, vegetarian, or non-veg, can be harmful to your health. Okay, so no comfort foods. So you can't go back to eating ice cream sometime or eating cookies or cakes and then having your bacon. Make sure you're not eating fast food. By taking off the burger bun, it does not become keto. You're actually still eating really horrible meat and probably processed cheese that's really not cheese. Okay, sugar by any other name is still sugar. So you can call it a keto ball, and you can add in dates, and you can add in honey and agave or brown sugar or sugar in the raw, but it's still sugar. So if you're planning on going on a keto plan, remember you're either getting your fuel from fat or you're getting it from sugar, and you can't really modify it and still call it a keto plan. Okay, that doesn't mean you can't eat those things. It just means that you're not on a keto plan. You may be on a paleo or a modified Mediterranean diet. Okay, there are hidden sugars that you need to be careful about. Barbecue sauce. Just because you had ribs soaked in barbecue sauce doesn't mean you're on a keto plan. That barbecue sauce probably has more sugar in it than a can of soda. Okay, so you can't eat ketchup that's high fructose corn syrup. Again, be careful. Read ingredients. Read your salad dressing. Look for things that look like sugar and maybe called something else. Maybe it's corn syrup or organic cane syrup or high fructose corn syrup. So make sure that you're reading ingredients when you're buying products. A high protein diet. Some patients will go overboard on the protein. Again, in a ketogenic diet, you're primarily getting your fuel from fat. When you start consuming more protein, it actually gets converted to glucose. You reduce your ketosis and you're actually consuming more sugar. So be mindful about how much protein you should eat. Most people will ask me, how much? 3 to 6 ounces per serving. Okay, that's how much protein you should be eating. So don't go to town on the protein if you're on a ketogenic plan. Okay. All right, so let's talk about a few of the food choices. When you're on a ketogenic plan and you need to consume 5% of your diet from carbohydrates or less than 20 grams of carbohydrates a day, what are some of your choices? 6 to 10 cups of vegetables. Most people are surprised that in the ketogenic diet, you're going to get that many vegetables. Well, you still need the water, you still need the potassium, you still need the magnesium, you still need the micronutrients, which are the vitamins and the minerals that come from fruits and vegetables, mostly vegetables on the keto plan. So you can eat as many leafy greens as possible. So a cup of spinach is only about 3 carbs, net carbs. Remember, a cup of cauliflower is only about 2 net carbs. So you've got leafy greens, spinach, kale, you've got asparagus, you've got cruciferous vegetables. Cabbage is huge in the keto plan. You can use cauliflower rice or cauliflower mash. That's huge on the keto plan. You can have broccoli, Brussels sprouts, any sprouts. You can eat above the ground vegetables like cucumbers. We really like to add vegetables into any plan, but even on the keto plan and the paleo plan and the Mediterranean plan, your base is always 6 to 10 cups of vegetables a day. Okay, so how do you build on that? Protein. So if you're eating meat, you want to get grass-fed, you want to get wild game, you want to get organic, you want to get wild caught, right? So if you're eating fish, you want to eat fatty fishes that come from nature. You don't want to eat farmed food. You don't want to eat feedlot food. You want to eat real, whole, unprocessed food. You can have dairy if you're vegetarian, so your eggs should be omega-3 organic eggs. Make sure that your dairy, again, sugar is high in milk products, especially skim, so skip the milk. If you are going to do milk, do coconut milk, do cashew milk, do almond milk, to try to avoid the amount of lactose that comes from milk products. When I mean dairy, I mean heavy cream, ghee, cheeses that are hard cheeses that come from good grass-fed sources. If you're not eating a vegetarian meal, you're eating a more vegan meal, again, your protein sources are going to be more like tempeh, natto, tofu, seitan, vegan meats, so that you might be able to get your protein from some of the vegetarian sources. There are some other substitutions for eggs. Things like flaxseed can be ground and added with water to sub out for eggs. You can use baking soda in vinegar. You can also use other vegan substitutions for eggs as well. So that's for the protein. For the fats, again, when you're going 70% on fat when you're a keto plan, a lot of the fats come from animal fats. So if you're eating hamburger meat and you're getting grass-fed, make sure it's an 80-20, so you're getting a good amount of fat. If you're using things like pork products or bacon, make sure it's nitrate-free, processed-free. Try not to go with sausages or hot dogs. They have a lot of sugar added to those processed meats. So go with clean products if you are a meat eater. If you are not a meat eater, you're vegetarian, again, your fats can come from dairy sources, or your fats can come from nut butters like coconut, coconut cream, coconut oil, coconut meat. You can use nuts like cashew butter, cashew yogurt, cashew milk, almond flour, and yogurts and oils can be used. Some people will use soy products. Again, that's perfectly okay if it's in your palate. And again, if you're vegetarian, a lot of your oils also come from nut and seed sources. So that's everything for the ketogenic diet compared to the paleo and more of a low carb or Mediterranean diet. The bottom line is this: eat clean. Whatever product you purchase should come from natural sources, should be free of toxins and pesticides, because more than likely that's causing disease. Make sure you're preparing your food, try not to eat out, and be realistic with your goals, and make sure that you've got a plan that works for you. And lastly, always talk to your doctor before making any changes to your dietary plans. Make sure you don't have any health reasons or contraindications with this type of eating. I'm Dr. Jyoti Patel. Thank you for joining me this morning, and I'll see you next time.